back to Road Gang Radio with Jimmy Mack, Lindsay Lawler.
Give me a minute, y'all. I'm coming.
And you, because if you're listening, you're in the gang. Take it away, founding member Phone Master Dre.
You are part of the gang because this is Road Gang Radio live from the House of Degas in beautiful NOLA with your host, Jimmy Mack.
By the way, carefully picking the best partners. We talked about that when Kevin Lindsay came on, because no matter how good you are, you're only as good as the folks who ride alongside of you. But even if you do all of that right, you still got to keep that sharp eye out. Pre-trips prevent maintenance. Maintenance prevents catastrophic failure. And yes, managing those moments when inevitable catastrophic failure arrives means you've got to make sure that you've picked the best partners. We picked the best partners for Highway to Health. So much of the conversations here have been about well-being and fitness and, paying special attention to special months and special weeks and special days. So much of your health out there is dependent upon sometimes the folks you ride with. And sometimes the folks you ride with sit in the cab aside you, and they're on four legs.
And they're a little hairy.
And they're a little hairy. And we've actually talked about that at length on occasion, the idea of how to maintain your health while maintaining the health of the wonderful friend that rides alongside of you. We have the best person in the world for that. The best. Dr. Carol Osborne, DVM, is an integrative veterinarian. We've spoken to her on numerous occasions. This is kind of an interesting topic we're going to get into here, and one of those things that you can actually prevent by keeping a close eye out, but also making good, healthy decisions for your pet before we even get started. But before we even get started, what do you say you guys go to Chagrin Falls petclinic.com. You can find them on Facebook at PAAWS. It's Paws with a double A. Doctor, on Twitter, it's Carol on Pets, and on Instagram, it's Dr. Carol DVM. And it is our absolute pleasure to welcome one of the best people in the world, Dr. Carol Osborne. Good morning to you, Doctor. How are you?
Oh, very well indeed. Thank you.
What we're talking about today, though, is breast cancer awareness for dogs. Because so much of what happens in regards to animals, by the time we realize something is wrong, it is very, very late in the game, and either we're looking at a lot of expensive treatments or we're looking at no choices to be made. So much of what we're talking about today, and you can correct me if I'm wrong, is also making sure that we make decisions for our animals that will allow them to lead healthy, happy lives before we get to that terrible moment. But it does happen. Breast cancer does happen in dogs, does it not?
It does. It's actually it's quite common, especially if you have a female dog, that hasn't been spayed.
And I want to kind of begin before we get to even the idea of dealing with the issue we're talking about, to talk about spaying. In this day and age, it should be an obvious conversation, but it's not. Can you kind of take people through, besides the obvious advantages, the overall health impact of what it can mean for a dog's life and for your own mental well-being if you, in fact, get your animal spayed?
Yeah, well, in the case of breast cancer, if you have a female dog and you have her spayed young, when she's less than a year of age, the chances of developing mammary cancer are pretty much nil. And then, of course, if you wait a little bit longer, the chances can elevate a bit. But it's mostly if you have older female dogs, 6, 7, 8, 9, 10, 11 years old. Those dogs, if they're not spayed, they would be at the highest risk of maybe getting a lump or a bump, underneath their tummy. And there's some breeds, poodles, dachshunds, German shepherds, and spaniels. They seem to have a genetic genetic link, if you will. So if you have one of those breeds and a middle to older age female who hasn't been spayed, which is a very simple operation these days, that'd be something to talk to your veterinarian about.
Let me kind of ask you a question, because a lot of our listeners here, as truck drivers, often are farm owners. And, there's responsible pet ownership even when the dog is allowed to breed, because if you are, in fact, on a farm and your dog does breed, often that people, and especially kids, can get their hands on pets at a much cheaper rate than they would, say, from a breeder, or even to find the kind of right dog that they're looking for. So we're not saying that people can't, use their dogs, especially in rural life, to breed. Is there a point, and I guess this is my follow-up question, do the numbers change again if, let's just say, you have a female dog, and at around 4 years old you allow it to breed, but then once it breeds you say, okay, that's enough, we're going to spay the dog. Do the same numbers apply? Does the possibility of breast cancer reduce from the moment you spay?
Well, that's a good question. The numbers certainly don't go up. You have to remember that just because you have a female dog that hasn't been spayed, it doesn't necessarily mean she's going to get breast cancer. It just means that if you have a female dog that you use for breeding, when you have finished that, I think that getting the dog spayed is certainly something that should be on your mind. It's a very smart move. But more importantly than that is, no matter how old your dog is, take a couple minutes each day, take a look at your dog, run your hands all over the dog's body, under the tummy. In particular, if you're concerned about mammary gland health, and if there's a lump or a bump or something that shouldn't be there, pick up the phone, give your veterinarian a call. And make sure of what the lump or the bump is, because in most cases, the sooner that you jump on it or address the situation, the better off you're going to be.
And you point out in the notes that you sent that over half the tumors are malignant, and a good deal of them have metastasized by the time they're initially diagnosed. And I kind of want to go back to some dog care tips here as well, too, because what you're talking about doing, a lot of people who are pet owners never think to do. And the idea that your dog trusts you, and if you're gentle and kind with it, there's almost no place that you can't do an examination on a dog to get a sense of it. When you're doing that, how do you go about figuring out, like I said, giving it a quick feel, I understand that, but how do we feel for pressure, and how do we feel for what's not right? Because, like I said, once the dog trusts you, it becomes a much easier exercise just to kind of take our time and go through the entire landscape of the body to figure out, where the anomalies might be. Is there a particular approach to gaining trust with an animal so that you can, I guess, for lack of a better word, be intimate with it in a way that is saving and protecting its life?
Yeah, and again, starting out life with a puppy is ideal, but not for everyone. You just have to try to be able to touch and handle your dog as much as possible. If it's a rescue, an adopted dog, something like that, you have to go slow. You might start with the head and the neck and the back. But basically, it's simply running your hands along the dog's body if you're not sure. Stopping at your veterinarian, and they can show you that it's nothing special. Just take your hands and, run them around the dog's body so that you are able to differentiate, normal from abnormal. And that's I think the biggest thing is, know what's there. And if you find a puffy spot or a lump or you're not sure about it, ask, and you'll get an answer. If you have a timid dog, you have to just have a lot of love and a lot of patience, and just kind of take one day and then the next day. But as they learn to love and trust you, most dogs love to roll over and have a good belly rub. And while you're doing something like that, you can see what you see and obviously feel what you feel. Whatever you're not sure, just ask.
I love it, too, the idea that if, in fact, you are doing that for your dog on a regular basis just to make them happy, you also get a sense of when something feels different than it felt before. And that's really kind of a groovy thing about it. You also mentioned that obesity is something that we should really look out for, that we can walk our dogs, well, we can not walk our dogs into breast cancer by simply not taking care of them. And I've never had a problem with people who spoil their dogs. And I don't mean spoil their dogs in regards to give them whatever they want, but really kind of take care of their dog in the same way they would take care of a child, or the same way they would take care of something that they really care about. What is a really kind of great foundational diet for the dog in the beginning, and one that is going to guarantee the best health outcomes?
Well, I think when you're choosing a food, you need to choose a food that's suitable for your dog's, age, health status, body condition. Again, your vet's probably the best person to help figure out a good food choice. But for me as a veterinarian, I think a fresh, wholesome diet, even a homemade diet, if you have the time and the wherewithal, is probably going to be better than a lot of the things you're going to find in a bag or a box. But, you want to have lean protein, whatever kind of meat that might be. Chicken, turkey, and pork are the white meats of today. But there's red meats, lamb, beef, veal, etc. You want to think about a long-acting carbohydrate, potatoes, pasta, rice, noodles, quinoa, for example. Oatmeal is also a great one. And fresh vegetables. I always put cruciferous on the top, broccoli, cauliflower, and Brussels sprouts. But the list of good veggies, green beans, string beans, kale, cabbage, etc. If you have a dog in a good body condition, not too skinny, not too fat, 1/3 of each, cook them up any way you want, mix them together. All dogs should eat at least twice a day. If your dog's a little bit on the pudgy side, cut the carbs and go 50% lean protein, 50% veggies. And if your dog's a little too skinny, you might want to increase the carbs a little bit. The top 3 flavors most dogs love: barbecue sauce, pasta, or tomato sauce, and low sodium tamari, which looks like soy sauce, but they call it tamari.
Which, by the way, I love, by the way, Claire, who my wife Claire loves tamari sauce, and they really do. I've noticed that too. I've seen dogs when they get a little tamari, they get very, very happy. I'm not sure if dogs actually smile, but it sure looks like one when you put a little bit of that tamari on top of it. The other thing I was kind of curious about in regards to diets is, they are omnivores, and you're pointing this out to us by explaining the diet too, because a lot of people often love their dogs, take care of their animals, but they often get a little bit too reliant on one particular kind of food, or even when they're doing it natural, they're doing stuff where you really do want to create that balance. That's really crucial, because you're trying to cover as many food groups as you possibly can, and then it becomes a matter of simply eyeballing the dog and making sure it gets enough exercise. Correct?
Yeah. The rule of thumb when you are trying to figure out if your dog is in a good body shape, if you will, is you should be able to easily feel but not see each rib. And a dog should have a waist, which is a little tucked up area right in front of the hind legs. So, if you could pinch more than an inch and your dog's tummy looks like a big barrel, it might be time to think about cutting back a bit. And you mentioned a variety of foods and whatnot, which is definitely a good idea, particularly for you kitty owners out there. Cats get addicted to not just the taste of the food, but if it's a dry food, for example, the size of the kernel, the shape of the kernel, almost anything you can imagine. So particularly, again, if you're starting out with a young cat, you want to switch those foods around all the time so that you don't end up with a super finicky, cat like Morris.
Oh yeah, I'm telling you, man. I mean, and as the owner of cats, we have we have 2. We had 3 for a long time. They are incredibly picky eaters, and the mistake that we did not make with the last one was we did mix it up, and so she's a much less kind of snobby eater, as it were. It's like, I like what I like, or even not even snobby. They turn into kids with macaroni and cheese and chicken fingers, where they're just like eating the same thing over and over and over again. Okay, so let's say the worst comes to pass. And despite all your best efforts, despite the fact that you spayed them, despite the fact that you've kept their health in good shape, that in fact at some point you do find a lump. Take us through possible prognoses. Take us through possible outcomes.
If you find a lump, you visit your vet, and usually the vet will, they'll take a little sample of the tissue. It's called a biopsy. It's a teeny tiny piece of tissue. Excuse me, and they'll send that into the lab. And that'll give you an exact diagnosis. You know exactly what it is. So if it is, if it is cancer, unfortunately in dogs, about 50% are the bad kind, the malignant kind that can spread. But they also check lymph nodes and whatnot to see if it has spread, or if it's gone into other of the mammary glands, which is along your dog's tummy. And usually that'll be addressed by surgery. They'll do a mastectomy, as they do in humans. And sometimes, they might combine that with a couple of other things. What's interesting about dogs that's different than in people is, a lot of the chemotherapy and that kind of thing doesn't seem to work very well in dogs. So that's unfortunately not an option. The chemotherapy and radiation just don't seem to be successful in dogs. But it doesn't mean it's the end. What it means is address it quickly. Your vet will do stage it, let you know how far it has or hasn't spread, and they can still enjoy quality life, just usually for a shorter period of time.
Yeah, and what all of this is kind of saying also is that often it will mean a surgery, since there are no other treatments available, radiation or chemotherapy are not available. It means that surgery is available, which also means having to make a determination about how much surgery is going to happen, and of course, as always, and you say this best, always go back and consult with your vet. Talk to them, try to figure out what's going on there. Okay, so let's just say you take a shot at the title. You find something, it is malignant, but they're able to go out there and get it out. How do you help your dog recover? And I have seen this from time to time, the idea of an animal that is suffering a little bit or maybe have a developing problem, and, some surgery and a change in lifestyle for the dog does improve the quality of life and gives you a better outcome. What should you do for the dog, for the animal, once it has undergone its surgery and you begin to kind of, figure out what to do next? How can you help it along?
Yeah, I think, other than all your love, which is always the most important thing, if there's antibiotics or whatnot, you want to finish those, per your vet's suggestion. We have anti-cancer diets these days, which basically anti-cancer diets, because cancer cells kind of live on carbs, all the stuff we Americans love. Basically, you're talking about meat, white meat, chicken, turkey, and pork, any kind of fish, and veggies, putting those cruciferous vegetables on top. But you can mix those up any way you want, and feed your dog multiple times a day. So you want to go with the protein and the veggies, eliminate the carbohydrates. And there's different supplements and antioxidants that again can be very helpful to, sort of keep your dog's body as strong as it can be, while this is going on, and try to ward the spread of that particular type of cancer or slow it down, the very best that you're able to. And in our experience, many dogs enjoy many more days of high quality life than the initial prognosis that individual might have been given.
The other thing is too, and I want to kind of go back here for a second. A lot of people know too, surgery in human beings is often very invasive, even in the best cases of scenarios. With dogs, because of where the mammary glands are located, just to kind of give people some reassurance here, surgery has much better outcomes in this case, and it isn't as barbaric because, well, explain why. I mean, it's not as hard to remove a tumor often from a dog as it is from a human, correct?
Yeah, that's exactly right. Whether they're, removing one mammary gland or, doing a radical mastectomy where maybe they have to remove all the glands, on one side or another. There's the mammary tissue in a dog is on top of the muscle, so it's just a much easier surgery than in a person where the glands are located beneath the muscle. And that makes things a lot more complicated. So it's not a difficult surgery, but it is something that you want it to be done properly by somebody that does it often, perhaps a specialist or your own vet. Again, those are all personal decisions. But I think in most cases, run your hands over your dog every day. If you find a lump, get it addressed. And if you have a dog, even if it's a dog that you bred, quite honestly, by the time the dog is 5 or 6, getting that dog spayed should be right on top of your mind, because that's the best way to just avoid these situations completely. In most cases,
priority one, as a matter of fact. Guys, go to Chagrin Falls petclinic.com, PAAWS over on Facebook, Carol on Pets on the Twitter, now known as X, or go to the gram of Insta at Dr. Carol DVM. You can find her there as well. Okay, this is my selfish question of the day, and it deals with both cats and dogs. And you brought up antibiotics, and my selfish question is there a strategy to give animals pills who somehow seem to be the cleverest in the world and manage to eat every bit of food except for the pill that's inside of it? Is there a given way that actually works to help your pets be able to take pills when they need to?
Yeah, absolutely. Usually if the pill is tiny, or maybe you can break it in half, hide it in something scrumptious and give it to them as a treat before the meal, when they're hungry. That works for a lot of dogs. And for the ones that are really smart and that, eat the food and then spit out the pill, sometimes you have to just hold their head up a little bit, rub their throat, and blow in their nose. That stimulates the swallow reflex. And when they stick their tongue out, they swallowed.
Oh, I didn't know that. That is quality information. We got a ton of quality information before that moment, but I feel like I've hit the mother load. I'm actually gonna give Claire a call and be like, I know how to do it. I know how to get that pill down.
The big thing is you never want to put pills of any kind in your pet's food, because they've got a great sense of smell, puts yours and mine to shame. So usually when you do that, they just stop eating. And when your dog is sick, if he or she has cancer, etc., the last thing you want to do is stop eating. So give the pill as a treat before the meal when your pet is hungry. That's going to be your best shot.
Let me ask you too about a dog's sense of smell. This is just a big kind of generic question. So their sense of smell puts us to shame. How does their sense of smell function? And I realize that's a broad question, but are we talking about, do they use their noses in the same way that we use our eyes? Is that the kind of level of nose?
Yeah, it's a great point. When you and I walk in the room, we see the room. When your dog walks in the room, he or she smells the room. And the reason for that is a large percentage of our brain is composed of receptors dedicated to vision. But in the dog's brain, the largest percent is dedicated to receptors for smell. So if you had an Olympic-sized swimming pool with one drop of blood in it, that dog would know instantly. So their sense of smell is just, their whole life is about smell. And again, if you have a dog with, unfortunately, with end-stage cancer, which is the worst thing you could have, remember that using that dog's appetite is the single most honest way that a pet owner can know, how does my dog feel? You want the pet to continue eating, and the stinkier and the smellier that food, sausage, pepperoni, that kind of stuff, the more likely that the dog is going to be interested in eating it, because dogs don't even taste their food until it's actually in the process of being swallowed. So it's all about the smell.
Really quickly before we get out of here, Dr. Carroll, one of our favorite people in the world, my producer, Phone Master Dre, has been dying to ask you a question, so I'm going to let him get one in here.
Sure.
Well, actually, I'm going to save it for next time since we got to get out of here and transition to good old Lindsay Lawler. But I just want to tell you thank you, because each time that you've come on, I've taken my fair share of notes, and in a way, it has helped my dog with her weight problem, with her coat problem. But then also with you saying what you said today, I'm going to put that in consideration, because I completely switched her diet with asking you questions in the past and then having you on, and it's completely changed her. And then also having my girlfriend's dog be her best friend / like anxiety partner, because when they separate, that's just a nightmare for both of them.
Yeah, and I'll tell you what, we make a lot of dogs into vegetarians. Fresh vegetables. Those cruciferous, depending on the size of your dog, you want to feed them 4 to 6 times a day.
Yes, ma'am.
Vegetables. It's the dry food that makes pets fat.
Oh, my dog is obsessed with sweet potatoes.
Yeah, get rid of the dry food and go for the veggies, and you'll be amazed. You'll end up with a whole new dog if you get rid of those extra pounds.
Well, thank you very much there, Dr. Carroll.
Dr. Carroll, thank you. We're going to get you on board sooner rather than later. It's always great talking to you. Thank you so much for the time, and thank you for the great information, both the broad and the specific stroke. Thank you.